What's up guys, John Haas RN, founder of NRSNG, and this is another Tuesday Test Tips. Be sure to hit the like and subscribe button below because that's what I'm supposed to say on YouTube. Alright, today we're going to talk about the importance of knowing normal. What does that mean? Well, with your patients, you're going to be seeing all different kinds of lab values, you're going to be seeing all different kinds of fluctuations in your patient's neurostatus, their vital signs. Why is it important that you know normal? The number one reason you gotta know normal is so that you can know when things are going up or down. So rather than just looking at what your patient's presenting or seeing something on a report, you can say, well, I expected that because I know normal potassium levels, so I expected this on the heart rhythms. Knowing normal helps you identify early changes in your patient, and it helps you take better care of that patient. So the things that I would tell you to focus on as far as knowing normal would, number one, be lab values, would be heart rhythms, and would be the neurostatus. There's all different normals that you can know, but if you know those three, you're gonna catch variations and potentially detrimental changes in your patient. So knowing their normal neurostatus and knowing what you should be expecting, knowing normal lab values and what you should be expecting, and knowing normal EKG rhythms and what you should be expecting. This is gonna help in every area of the nursing floor. So not only do you need to know normal expected ranges of lab values, but you need to know your patient's normal. If my patient's normal for neurostatus, for example, is already a little bit somnolent or something like that, if I go in and they're still somnolent, I don't need to freak out about that. I know that that's where my patient is and that's what I'm expecting. And you got to make sure you report these normals to the oncoming nurse as you're leaving. So that when your patient, if you had a somnolent patient who's not very responsive, but you don't tell the oncoming nurse that, and they go in to do their report and the patient doesn't want to wake up and talk, they're gonna freak out. So not only do you need to know the normal, you need to make sure you're passing those normals on, especially in assessment data. And that way we can have continuity of care with our patients and we can make sure we're catching any changes as quickly as we can. All right guys, so when you go out there and study, like I said, look at lab values, look at neuro, and look at heart rhythms. Memorize those things, memorize what you should be seeing, but also more importantly, remember what your patient is presenting and what you should be expecting in them. All right guys, this is another Tuesday Test Tip. Go out and be your best selves today. Happy nursing.